I'm Jane and I'm 60 and I'm from Yorkshire. I was 58 when I was diagnosed with heart failure. Before I was diagnosed, I felt generally unwell, tired, wasn't able to do the things I could normally do, and I got feelings of bloatedness, occasional bouts of feeling flu-like symptoms. So I went to see my GP. I thought I'd perhaps got flu or a chest infection or pneumonia, something that wasn't going away and I'd not dealt with it properly by seeing a doctor earlier. I had those symptoms for probably about a year before I was eventually diagnosed with heart failure, and that was because I was diagnosed with other things. So it wasn't till I'd been continually going back to the GP and the things that they were suggesting were wrong with me just didn't seem to fit, and I was getting more frustrated and also not feeling any better, that they really took any notice of me. I was referred eventually by the doctor and said that the acid reflux tablets weren't making any difference, I was feeling worse. And the doctor again just looked at me and slid some tissues across the desk and said, "Is there anything you're feeling anxious about? Is there anything happening at home?" I'm not a person who gets upset easily, but I was just so frustrated by it all, and I just said, "I'm so frustrated that there's something wrong with me and I don't know what it is, and no one's telling me what it is." At that point, the doctor suggested I had a blood test. And it was at that point I had a blood test, and a week later they called me back, and he then explained that there was some measures in the blood test that indicated that there might be something the matter, and they were going to refer me to the hospital, to the cardiology department. There was no mention of heart failure other than he would make that referral. So it wasn't until I went to the hospital and had some tests there in the cardiology department that the consultant then told me that I had heart failure. I couldn't walk upstairs easily, couldn't carry the washing upstairs. I couldn't walk the slope up at work, couldn't carry my bag to work with my laptop in. I live on a hill, I couldn't walk up the hill without having to stop. So I knew there was something wrong. That's not normal. It was certainly delayed for many reasons. There certainly was an impact on my daily living because I just couldn't do some of the things. For instance, if we went on holiday, I couldn't walk far, I couldn't go out in the heat. So my husband and my daughter, they had to do things on their own because I just couldn't do them. At work, if you're getting fatigued, you can't do your job. So yes, it did impact on my daily life. Once I was diagnosed, the biggest thing was getting information. That was the biggest thing. I'd come away from there in shock, really. And I tried to make an appointment because I thought, well, I need to speak to somebody about it. So I had to make an appointment and go and talk to my GP. So at least I would have some explanation of how it could have happened and what I needed to do and what the implications of it were. And I felt that there wasn't really any of that. Once you'd seen the consultant, you were there, you'd had your appointment, we'll refer you for drug therapy, but you were kind of left in limbo till all that came in place, just wondering, well, what does this actually mean? Yes, because if I'd have known that those were symptoms, when I'd gone to the doctor, I would have insisted that I had tests to confirm or rule it out. Instead, I allowed them to be quite dismissive about it and do really the minimum. that they needed to do.